So what I'm going to try and do in today's talk is to just give you kind of an overall picture of how it is to be a doctor, what it takes to kind of go through the journey, and really show you what is it at the end of the tunnel, as most of you who are aspiring to be medics would know that there are a lot of difficulties, there's a lot of joys, and really it's a lifelong journey that you embark on once you get into the medical school. So I'm going to just make some very quick introductions. So this is just a picture of where I work. So I'm a doctor working in the Queen Elizabeth Hospital. I'm also a research fellow at the University of Birmingham. And really, I started my journey in Pakistan in 2011 when I graduated. So I'm a specialist registrar. I work for internal medicine. My specialist interest is gastroenterology. I also have interest in liver disease, and hence I'm doing a research degree in that. So where did I start, and what has been my journey? So really 5 years of medical school. I had to give 2 exams because I graduated in Pakistan, and then MRCP exams is kind of a must when you are entering hospital medicine. So really, I've given 5 exams, and it's taken me over 10 years to kind of get to a consultant post, which I still haven't reached, but that is the eventual plan. Now, this is something that everyone needs to keep in mind, the amount of time you will be spending, not only in medical school, but really a minimum of at least 8 years if you are looking to come into hospital medicine. Now, there are other specialties once you join medicine that have a quicker route, for example, general practice, and Anita's going to discuss about that at some point later on. So so once you finish medical school, some of you may be aware there's 2 years of foundation, and now the core medical training, which I did for 2 years, has been extended to 3 years. This is also something to keep in mind, but that obviously means the specialty training is reduced by a whole year. So now I just wanted to talk about medical life in general, and what I found quite rewarding. Now, there are lots of misconceptions around being a medic when it comes to work-life balance, when it comes to finances, life in general. What I find while speaking to medical students and teaching at the university, that there is, the coronavirus in general, and before that, the junior doctor's contract, and a few other things have really demotivated a lot of individuals. And I think it's important to kind of just shed light on that from somebody who has been amidst all of this. So I think the first misconception is that are doctors working 24/7? I mean, do we really have a life outside work? So yes, I think at the moment there is a lot of flexibility offered, but you really need to ask for that. So you have the opportunity to work 80%. You have the opportunity to work 60%. So if you are somebody who has other hobbies, or who has a side business, or who just doesn't want to work that much, you do have the opportunity to reduce your training in a certain way, to extend the training and work maybe 3 days a week rather than working 5 days a week. Now, what I also find is that for me, for example, the most important bit was the fact that my job is not monotonous. I see people, and when you see people, you interact with them, you chat with them, you make friends. And really comparing this to a desk job or a job that has to do with computers, I find that this keeps me going. You miss human interaction, especially when coronavirus hit and we were all in lockdown. I understood how important it was for me to meet people in person. Certainly satisfaction, of course, when you when a sick person comes in, he's very sick, you treat them, you get them better, you see them the next day. And the satisfaction of that cannot be replaced. So you can really make a difference if you are somebody who wants to do good. I think the medical profession is great. And finally, finances. I think doctors are relatively well paid. You've got one of the best NHS pension schemes, so you have the opportunity to work extra. And really, I mean, that's a whole different topic. But I personally find that even during coronavirus pandemic, when most businesses and things were affected, one has to wonder about financial, stability. And I think the doctors, in my opinion, will never be out of work. So there'll always be demand, there'll always be work. So I think that's an important aspect here. Now, what do I do when I'm in hospital? So I'm a gastroenterologist. So really, I am one of the frontline emergency medical specialties. So what I find about gastroenterology or cardiology or emergency medicine is the adrenaline rush. So you are seeing the sickest of the sickest patients. So people who are, could be bleeding from their stomach. Really, you have to deal with a lot of emergencies. There is a lot of overnight calls. You could be called in to see someone in, and really you are saving lives on a daily basis. Now, I'll just give you a very brief overview of what I do. My day is never monotonous. It's not the same. It has something new every day. So, for example, this was one of the first weeks when I started. First urgent referral, a 17-year-old boy who had quite severe autism, had eaten a pin, and they wanted us to retrieve the pin from his stomach. So this is what we do. So endoscopy is bread and butter of a gastroenterologist. So what we do is we put a camera through the mouth. It's almost like playing a video game. If you're interested, there are two wheels, and you really need to be very very skilled to do this. And this is something we do on a daily basis. So you lie the patient down on the side, you put the camera in, and when we went into the stomach, we found that pin there. And you use a net to retrieve that. And really, the boy was discharged later on in the day. So this was quite fun. And then a second case came in when a patient was vomiting frank blood. And really, it can be quite daunting when somebody is vomiting, bucket loads of blood on you. And you have to keep your calm, you have to keep your composure. And try and work through it. So that again involves a lot of different specialties, running around, doing things in a very quick but organized manner. We also do clinics in a week. So, a 3-hour clinic. Between that, you have a good 1 or 2 hour lunch break. You can go for coffees, you all get together. So it's quite nice having a big, nice team around you. And really, they become a second family. You spend more time with your colleagues than your family when you're working as a doctor. So I think that interaction is fantastic. What else do gastroenterologists do? So as I mentioned, we deal with everything from starting from the mouth all the way down to your back passage. So really, we are dealing with the biggest kind of system in the body. From your livers to your stomach. I'll show you a very interesting case. So this picture at the top left, this is a tumor in the gastrointestinal tract. The B picture shows that we're putting something called a snare around it. So it's almost like we're kind of hugging it from the bottom. The picture C shows that we've clipped that. And in D, you see the tumor coming off and actually going away. So you can retrieve it, you can let it pass through the back passage. And then you can see in G and H that we apply clips from where it was taken out, it was bleeding. And H shows a fantastic, nice, clean picture of multiple clips that you've put in there and stopped the patient's bleeding. You've taken the tumor out, and a really satisfying procedure done in the matter of less than an hour. So if any one of you is interested in gastroenterology, later on after starting medical career, really we offer cutting edge technology, cutting edge new techniques that are coming in. So there is a lot to learn. Now, it's also very important to kind of start planning early for this. And I'll talk about that in my latest slide. In the bottom picture, because I deal with liver, I have interest in liver disease. We in the University of Birmingham are one of the biggest liver transplant centers in Europe. And as you can see, this is a liver lying in the bucket there, believe it or not. Really, this is again fascinating, where patients are getting liver transplants almost on a daily basis. And this is again life-saving stuff. You know, patients would die in a matter of days if they wouldn't get a transplant. And you know, the team there is fantastic. So again, if somebody's interested in doing something like this, your choice should be gastroenterology. Okay, now it's important that we all, when it comes to choosing your medical profession, going into your medical school, you'll have mentors, friends, families, people like Catherine and Shri who've done Medapply, and they will give you advice on how to get into medical school, and that's fantastic. But I think it's also important to start planning things early. Now, that is my key kind of tip to everyone there, because I find within my colleagues or people who are very early on in their career, there is a lot of uncertainty, and there's almost like disbelief in their own kind of capabilities, and there's a lot of doubt. So if you are embarking on this journey, what you need to understand is that you need to plan early. So you need to decide what you want to do. You cannot be starting a career and taking up a role of 5 years and then deciding in 2 years' time that this is not for you. You will be wasting time, effort, and if you change your career path, that can be quite daunting as well. So decide early what you want to do. Probably once you are in your medical school and you are getting a flavor of going on the wards in your 3rd or 4th year, try and make connections, try and make friends, understand how people enjoy their lives. What I found about gastroenterology was that all of the consultants or colleagues were very friendly. I don't know what the reason was, that it was just something I really enjoyed. So it might be that one specialty isn't for you. Always ask for help. So whether you're in medical school or you're embarking on your foundation year careers or later on, if you are in a dark place because of personal reasons, work reasons, or education reasons, always ask for help, whether it's your friends, family, colleagues. It's very important to stay in touch, because most of us are going through the same process or have been through the same process. And I think it's important to make friends along the way. As I mentioned earlier, you spend more time at work than with your family. Really, your your colleagues become your second family. You're sharing an office with them. So, you try and make good colleagues. You can meet outside work. And I think the most important bit is staying very focused. You can see through my journey that I had to give 5 exams, had to move countries. And if there are any international medical graduates attending the course today, again, that itself is challenging, but it's very rewarding at the end. I think that's very important. And in terms of life outside work, when me and Anita are not working, we travel, we've got 2 kids. So, I think, again, a misconception that, doctors really don't have a life outside work. We try and take out time for various different activities, and try and live a very balanced life. So that's it for me.
Great. Thank you so much for such an interesting talk.